Good afternoon. You're welcome to your number one health program on radio, Health coming to you about something very, very important, and that's cataract. Research has shown that a quarter of Nigerians have one form of visual impairment or the other. Cataract is the leading cause of blindness in the country, with about 1 million people estimated to be affected with blindness among the population. Olaji Eze. Now, so on Healthline today, we shall be talking about cataract. And of course, I have here with me in the studio, I have two wonderful people here in the studio to do justice to what we'll be talking about today. I have with me Dr. Anne Okorafor Amogo MNI. Thank you so much for joining me. Thank you. Thank you for coming. And also, I have the Deputy Director of Nursing, Nurse Bankole Adelola Moji Sola. Thank you so much for coming on.
Thank you very much. This is the clouding of the lenses. The lenses are what we use to see. Is like a kind of visual help that help us to see far, that help us to see things as it were. A lens, that helps individuals to see. And when we are talking about cataract, it means that lens that we have had become cloudy. And so the individual will not have the opportunity of seeing clearly, as it were. So at that point in time, that individual will not be able to see any object at all. That is, it is fully matured, and the next line of action is surgery. So at that point in time, they will have to come to the medical personnel, that is the specialists in eye, to come and seek help. So when we are talking about cataract, there are lots of things we look at. And so let me stop at that, because you want me to tell you what cataract is, and I have done that.
Thank you, Nurse. Now, you talked about what cataract is all about. Some people, when they have eye issues, somebody can even suggest to them and say, you have glaucoma, or you have this, or you have that. How do we know, well, that this is cataract? What are the symptoms of cataract?
The most important thing is that the individual will not be able to see everywhere, because there will be cloudy of the lens, and that lens is the one that is helping everyone to see things as it were. So this lens become cloudy, that is, will become like milky. The lens is already milky. So, and even without looking at the person too much, you will see that this person is having cataract, and the vision becomes so cloudy, and the individual will not be able to see very well.
Is there something that will be attached to the lens, like maybe there's the coloring or there's a lump or something?
There is nothing. It's not that something is being attached to the lens. What actually happened there is that the lens become changes with time. It changes with time. The discoloration, it is a gradual thing, and it's come up little by it is full year.
Doctor.
Okay, she just said it now.
Okay.
You can
Like
have
different types. We have different types.
no cataract is cataract.
Okay, that we don't have different types.
We actually have different types.
All right.
When we are talking about cataract, we have congenital cataract,
Okay.
and when it is congenital cataract, like the program we are having, identifying that are having cataract, because with cataract, so some people are being born with cataract, and when they are born with cataract like that, when cataract extraction is done for them, they will appreciate what is happening in the world, because it means ab initio, right from start, they could not see anything. So now when they remove it, they will be able to see very well. Another type is traumatic cataract. When we are talking about traumatic cataract, it could be due to accident, it could be due to maybe slap in the eye or injury of any kind. You understand? So this will lead to traumatic cataract. It means that the individual is having normal vision until when this trauma occur. And when the trauma occurs, then the individual begin to have a cataract, and this will be extracted. Then another is age related. That the environment in which they live and all that, can predispose them to having cataracts. So we have the different types.
Sorry, ma'am. Talk about the program within the next 15 minutes. Sorry. Yeah, let's go.
Now, Nurse, you are talking about children having cataract. Can it be as a result of the lifestyle of the mother before giving birth to the baby?
Well, yes, I would say yes. It depends. We have different gene running in us. So this genetical thing is, can be passed from generation to generation. But in this case of cataract, it is not the gene now. It is the habits or whatever the mother must have been exposed to. Maybe the drug practices. When you wanted to start, you made mention that it's the first in the world today. So it means that as soon as the individual,
The people who work in environments where you can be predisposed to having trauma to the eye, you are advised to wear your appropriate PPM, you know, um, maybe goggles or things. And people who work, not even just trauma, people who work with metals, they use lights, those people who, I think they're welders,
Yeah.
You advise them to protect eye shield, to wear appropriate eye shield. So you don't have unnecessary exposure of the eye to things that could cause traumatic cataracts, like she said earlier. You also want to avoid when people, trauma from fighting, things like fighting and all of that. If having, because a blow to the eye accidents, I don't know if it's a bit more difficult to say, oh, well, anything that is hereditary is not up to anybody to prevent. If there's a gene that if it's hereditary, it's hard. But we will advise the mothers to eat healthy foods where the lens begins to become opaque. So for a rule of thumb, you want to the general advice is eat foods that are healthy to different parts of the body, especially your eye. So that's what I would
Go for the doctor to know right there that this child has cataract immediately the child is born.
Okay, yeah, it is possible. We would have seen the milky immediately, maybe initial part is growing. We begin to see that there is opacity, and we'll identify that, and then we begin to see the baby growing, and then 6 months.
When people start having issues maybe with their eyes, there are some people that the next thing they do is get to pharmacy, they go get eye drop and say, oh, they start doing self-prescription. What do you want to say to people who have eye issues?
very okay. Let me see. It's extremely important that people don't do self-medication.
Mm-hmm.
The eye is a very sensitive organ, and it's not just the lens. There are the cornea. There's some parts of the eye that if you use drugs when you shouldn't use them, you can actually damage the cornea. Cornea damage to the cornea, you are unlikely to be able, except to do a transplant. You can do corneal transplant, but it's not something that is very readily done or easily done. So the advice would be don't do self-medication. If you have a problem to the eye, for instance, if you have there are simple problems that you have to the eye, in the eye, maybe inflammatory lesions in the eye, and you carry yourself and go and use steroids in the eye, then you push yourself towards having corneal. Let them check, and the doctor will give you appropriate medication
All right.
to use.
Thank you so much. If you're just joining us, this is Healthline on Motivation 91.5 FM. Moving to the special segment, remember I have here with me in the studio Dr. Anne Okorafor Amugo MNI De Lola Mujisola. All right, now I'm sure you're here for a reason. And
Foundation is the arm of NNPC that is charged with making social impact in the nation, in the community at large. So it's like a give back arm of NNPC, sure that they come up with programs that will impact the community, Nigerians, positively and alleviate the suffering of Nigerians, especially less privileged people. You'll be surprised that some people, for a little amount of money, will not have a life again. All right. So that is what NNPC does. They do all kinds of programs all over the nation just to give back, for on behalf of NNPC, just to give back to Nigerians. So it's their corporate social responsibility, and they handle that for NNPC.
all right, now have you started this? I know, of course, you talked about the foundation, and of course, you want to get involved in surgeries and stuff. Now, will this be taking place?
So where this one that is on extraction surgeries in the southwest. So anybody from the southwest states, we're targeting everybody or anybody who needs the service in the southwest states. However, she will confirm that you won't turn them back because it's a service you're rendering. So we've said anybody in any of the southwest states, although Ogun is the focus, the center as it were, but right as we speak, there's ongoing screening, harvest eyes there to have appropriate spread. We've had people from Oyo, we've had people from Ekiti and Oshun come to benefit. People have come from as far as that you guys played, and they're here. They've come to benefit. And besides doing, if you want me to talk about the screening centers, I will do that.
Yes, I will.
Okay, I should go ahead.
Yes, you can talk about it.
Okay, so we started screening since the 16th of December at the FMC, Federal Medical Center, Abeokuta here. If you don't screen, you don't know who has some cataract that is mature enough. She spoke about mature cataract. Although these days, technology has made it such that you might be able to extract cataracts that are not quite mature completely. Every day that the screening started there on the 6th of January. So every day they screen, we're harvesting eyes, mature cataracts that are due for extraction. Now, the idea is to have all of them come, and we thought, okay, let's do all of them at FMC. But we've seen that it might not be practicable because of the distance to some of Likosi from Ogijo, the facility in Ogijo, the health center in Ogijo, to see whether we can, instead of bringing people here, do, and that's what we have agreed to do. And that's going to happen, where we're hoping we can fine-tune that plan with the state government so that we can be able to do that. Now, the state government, even before now, they also had some people on their list, because they too are doing work on eye care, eye health and eye care. They have a strong department that they're doing some work on eye care. So they've been going around. We were not able to cover all the local to go around. So they had a list that some of the people that they had a fair would be given, so that they could go to them would be too expensive, will not be worth it. So we say, okay, why don't you come? And they've come. We've assisted them with transport fare so that they can still benefit. So we have that, and it's ongoing, and we think that the program is going quite well.
Now, the plan is you want to do surgery for like 1,000 people,
Yes.
and I'm sure that like more than 1,000 people have shown interest,
Yes.
and to maybe go out of your way to surgery for
Good
them.
question. Well, you see, NNPC Foundation will continue to give to society, all right, to headquarters. And I'm sure they will plan another outreach for that purpose. But it's good to know that a few other organizations also, cataract extraction is something that is so dear to everybody's heart. You can imagine somebody who is blind was there. Maybe she's about 5. I don't remember.
Yeah,
About 5. She hasn't seen since she was born, and Now, because of this program, there's the lady told us that she was charged. Isn't that something worth celebrating? And we're hoping.
Of course.
Yes,
That's a great thing. Now you were talking about eye harvesting. Some people might be wondering the harvesting eyes. And then I happening.
Well, let me explain what I've seen. I've gotten what I want. I can now go ahead and do my work. So, but today, strategic in the sense that, you know, some of the associations or other groups and people never came to do the surgery at the end of the day. But the former flag of is now everybody will have seen, you saw, if you were there today, or the people, the reporters that came today saw that actually, and the people will see that actually surgeries have started. So if you are still doubting that is that not how they came the other day, they did it and nothing happened, you will see that these people can see that really, NMPC Foundation means business, means well for Nigerians, and means business, and has brought this very important and very noble. And it is ongoing as we speak, still ongoing at all the centers I spoke about. Liquid screening as well. So as we speak, they're still screening.
All right. If people want to be, maybe they want to make inquiries about, the project going on, is there a number they can call, or how can they contact the people involved?
Well, they don't need to call anyone. Let them just come to Federal Medical Center, Abeokuta. As soon as they get in touch with us, we are going to screen them phone numbers, and we will ask them that they will see our text and they will report back to us. And as soon as they get that text with the date we will give them, the surgery will be done.
Now, this surgery,
And we will not collect money from
All the drops, everything you're getting is free.
is free.
And I just told you that even the transport fare for some of them coming from Imeko, we had to, from transport fare.
Transport free.
now, there are some people that, when they get to hear that there's surgery, they get scared that, hey, are you sure that I'll still be able to see? Because some people maybe can't see and can't see well enough. And
Apprehension about surgery. Apprehension, and because, but we want to visit, most times it's not, it's complications. There are not too many complications most where the expertise is there. So we're assuring them we have the best hands to do the surgery. We have everything. Head of department. And program in FMC is headed by Dr. Abiko, who is a consultant of ophthalmology. He has assembled the best team in Nigerians.
is a consultant to NMPC Foundation on the 1,000 free cataract extraction program. And I also have Deputy Director of Nursing, Nurse Bankole Adelola Mojisola. And of course, I also want to appreciate Mrs. Olupumi Aki, everyone that has listened. And I'll try to actually pick one thing, the ICT guy,